So welcome, Molly. You helped produce and judge this last weekend's Nurse Hack for Health. Can you tell us how it went and some stats on it?
Sure. So in April, Rebecca Love and Marion Leary from Sanseal approached me to see if we could collectively address many healthcare gaps the COVID-19 pandemic has exposed through the creation of a nurse hackathon. In a matter of 4 weeks, Microsoft worked collaboratively with Johnson & Johnson, Sanseal, and DevUp to bring Nurse Hack for Health to life. Everyone came in this past weekend with a learn-it-all spirit. Learn-it-alls are curious, resourceful, and willing to fail, understanding that insights from failure lead to future success. Learn-it-alls see adversity as a challenge to be overcome, and they work toward the future with focus and determination. We had over 489 active users or learn-it-alls, 31 different hack groups, 25 judges, 30 mentors, and 9 different labs going on throughout the weekend. I want to share my appreciation and say thank you to everyone who participated in the first Nurse Hack for Health this past weekend, including all of the nurses, the physicians, IT professionals, developers, for taking time out of your busy schedule, your personal time, and to share your expertise and to solve real-world problems. I also want to shout out to all the mentors and judges and the backstage crew who worked tirelessly to produce the event, and all of my dedicated Microsoft colleagues too. So proud to work with everyone who made this happen. Now, without further ado, I'm so proud to share the winning pitches from across the 5 different tech challenge areas.
Great, thank you so much, Molly, and here are the winners.
My name is Joanna Seltzer Uribe, and I'm representing Team 15. Our question is, how might we increase the sense of safety for school reopening? The users we are designing for include school nurse Sally, who before COVID-19 had a ratio of 1 school nurse to several hundred or thousand students. She had death by paperwork and is in an information silo. We have petered out parents who are totally at capacity and need students to go back to school so they can go to work. We have students that probably want to go back to school more than they thought they would, but could be scared and worried about getting sick. We also have sideline nursing students who, because of their campuses and clinical sites closing, are unable to complete their required clinical hours. Yesterday, the CDC released these guidelines for students to safely go back to school. If you think that this looks like a lot of steps for a single school nurse to handle, then you'll agree with us that this looks good on paper. Our problem is that the National School Nurse Association reported last month that they're going to need an additional 10,000 school nurses in order to safely reopen the schools. We have a population of nursing students willing to help but lacking mobilization. Parents are fried, and tech alone is not going to be the remedy. We think we can solve everyone's needs by leveraging people and tech together. Our people solution is the School Nurse Corps. School nurses will be matched with nursing students on a multi-sided platform who can be deployed and help in a contactless virtual capacity. They'll be able to reinforce school nurses by helping to triage and analyze data prior to school start times, which coincidentally will help transform nursing education so students can learn more about informatics and community health, which are typically underrepresented in nursing school curriculum. School nurses will be able to multiply their power and reach by becoming an entire nurse screening team. And school nurses will be able to follow up on anyone that has missing data. And for anyone that's out of school, they can connect with contact tracers, emergency rooms, or pediatricians. Our tech solution will also include mobile screening for the students and teachers. And that data will be connected to RFID bracelets so that school staff like bus drivers can scan the students and know who's cleared and safe to get on the bus or enter the school buildings. RFID is affordable and safe, and this helps free up the school nurses to be on site and focus on all of the other issues like the asthma and the insulin and the ADHD management. We will also make sure to prepare parents, teachers, and students by giving them a care package prior to school reopening that will help to reduce ambiguity and anxiety and reinforce trust and partnership between school and families. This is a sustainable initiative because we will be able to pilot it as early as the fall And we can demonstrate a positive impact on reduction of missed school days, teacher absences, and community-acquired infections. It's scalable because there are over 300,000 nursing students enrolled in the USA. We have a business model that will be a nonprofit consortium, and those that are gaining the most in the current economy will help to give back to schools so their employees will be able to confidently go back to work knowing that their students and children are safe. Our nation is unified that we need schools to operate safely so students can achieve their greatest potential and parents can get back to work. Can we count on your support?
We are Team 26 here now, and as nurses, we fundamentally believe that our patients benefit when they see the images and hear the voices of their loved ones. Our team members, I am Molly Higgins. We also have Kelly, Rosemary, and Sabine, a group of nurses with different backgrounds. Thank you to our mentors as well. So the problem that we are solving is due to visitor restrictions related to COVID-19, families are unable to be at their loved one's bedside. So as of right now, the only option for our patients are to have these scheduled video calls and phone calls. The problem with this is that the participation is limited to only the people that are able to join at these specific times. And also to just a certain number of people that are able to be on the call at one time. So the timing isn't ideal for the patient at times where it could be when they are confused or sleeping, or also with the family, this could be not an optimal time as well, depending on what's going on in their life. And then also for the nurse who's very busy and has to coordinate this into her workflow. And this also takes time to coordinate even before the call or the video message happens. So because of this, there's vital connections that are missed from all other friends and families of the patient that could possibly be happening. So our solution for this is Here Now. And what it is a universal communication platform where any family member or friend can capture and record multiple messages and videos and just upload them into one central place. And these messages and videos are compiled throughout the day by friends and family members. And then they can be accessed and played at the time that's most optimal for the patient and the nurse while providing care. So the stakeholders and scalability for this, well, of course, the families. We all know how this feels to have a patient in the family and you're not able to connect with them, especially now when you can't be at the bedside. So this provides a way for family members for essentially all over the world to be able to reach out to their loved ones. And for the clinicians, this is the ability to create a special moment of connection. This is why we all went into this field, is that we want to take these moments that can be special and create them for our patients. So this also increases productivity by saving time, because with all the multiple people that want to be in touch with the patients, this is one central place where everyone can leave their messages. And lastly, for patients, obviously this is the biggest thing. It meets the fundamental human need to feel loved and connected. So this is a quote for one of the nurses on our team. "This morning, my uncle's heart stopped. I would have found comfort in knowing he heard a prayer I said for him. That would have provided closure for me." And then this can also, beyond the hospital setting, this can be in long-term care facilities, a caregiver at home with an elderly patient, the pediatric patient, in group homes. So here's an image of how this works. We have different family members or friends from all over who can say their messages, whether it's a voice recording, a video, as a grandchild reading a book. You can upload these messages to the storage, and then the nurse can play this for a patient. And this could happen at 2 o'clock in the morning when the patient all of a sudden is alert and wants to engage, and the nurse has this tool to be able to provide for the patients. So although loved ones cannot be here now, patients can always hear them now. So COVID-19 may isolate us, but it does not have to disconnect us. We can be here now. Thank you.
Welcome to Team Nurse GPS. A COVID patient is being transferred from the ER to the ICU. A nurse must quickly locate and gather critical equipment to limit entering the room multiple times. Unfortunately, on a large nursing unit, things like a medication cart and IV pumps have wheels, and small items grow legs. The scavenger hunt begins. Is there a better way? What if the nurse, with a quick glance, could locate all the equipment needed on this unit? Nurse GPS aims to shorten the time and resources needed to get crucial equipment to the patient. It's like searching for your keys before you leave the house. Now here's a demo of our application.
Patients that are being transferred into the ICU. By clicking on the first patient, she can see a list of the required equipment based on the patient's condition. In this case, there are 4 pieces of equipment needed. Nurse GPS shows Florence where she can find those pieces of equipment indicated by the green icons on the map. This greatly simplifies Florence's task of preparing the room for her new patient, Paul. Nurse GPS also supports scenarios where some equipment is already in the room where a patient is assigned. Florence's second patient, Grant, is in a room that already has an IV pump and a medication cart, so those are not on the required equipment list. Like with Paul, Florence has shown where she can find a TENS unit and a vitals machine. The closest available vitals machine to Grant is far down the hall, however, so Nurse GPS has highlighted a vitals machine in a closer room that might be available. Since it's in a room with an assigned patient, but is not a continuous use item, Nurse GPS shows this equipment in red, indicating that if she would like, Florence can go and check that room to see if it is available for her to use. Nurse GPS uses small Internet of Things, or IoT, tags attached to equipment. These tags interface with the hospital's existing Wi-Fi infrastructure for both communications and positioning. These tags allow real-time tracking of equipment, enabling Nurse GPS to always direct nurses to the right destination.
The time to market estimate is 8 weeks, with 2 weeks for prototype 4 and 4 weeks for pilot and 2 weeks for go live. A study done in 2011 showed nurses complete 72 tasks per hour. This was pre-COVID-19. Can't we make it easier? Thank you very much.
Nurses experience a variety of work-related stressors that can result in compassion fatigue, anxiety, PTSD, burnout, and moral distress. It's vital to support strategies to build resilience in order to prevent these issues from occurring. The problem. Today, there are limited nurse-specific coping tools which address professional-related stress and anxiety, while these conditions have an increasingly exacerbation due to the COVID-19 pandemic. We've heard firsthand accounts of barriers with traditional therapy due to concerns over mistrust or sharing of information with employers, speaking to somebody who does not truly understand what it's like on the front lines, and the lack of available resources. When taking a look at existing technologies to deal with these issues, they are unfortunately not designed for the end user, the nurse. Due to these issues, adoption rates of these tech solutions will not be as well as potential impact levels, until now. Introducing the WellNurse solution, a truly nurse-first solution accessible via a mobile app to provide coping interventions designed for nurses by nurses. Our mobile solution meets nurses where they are, in between their busy and unpredictable lives. WellNurse is designed around the unique culture of nursing using evidence-backed interventions proven to be effective from both mobile perspective as well as nurse-first perspective. In addition to the robust and strategically designed wellness tools and stress level assessment checker, we've added a community space called Connect that allows nurses to now have their resources, tools, and social protection all in one holistic app. So what really makes WellNurse unique? Our by nurses for nurses design process is the answer. We ensure the voice of nurse is presented and in context learning with relevant work-life situations. Other wellness apps have great traction and downloads and engagement, but don't have our unique user group, which allows WellNurse to build a community of support for nurses, while competitors won't be able to offer this strategic advantage. Our business model. First, we have the initial goal of delivering a holistic tool to as many nurses as possible. We've identified several grants to support this technology development related to COVID-19 response. Next, we'll partner with national and international nursing organizations to provide them with an opportunity to white label the solutions. We'll stimulate social shares by encouraging and empowering nurses to share for a cause. And finally, the long-term sustainability can be obtained through various strategies such as tiered subscriptions, ads, and B2B wellness metrics and insights for healthcare organizations. Why have confidence in WellNurse? Our team is a well-diverse, multidisciplinary, mission-driven organization that feels strong about the nurse and well-being. We understand the micro and macro consequences of not solving these big issues, and the right team to implement this and roll out the strategy can be delivered at a pace that will actually have an impact in the future of nursing.
We are Project Flourish, and we seek to make telehealth accessible to everyone. Our team has over 90 years of combined experience in global health, entrepreneurship, and health tech. The problem we seek to address is that most telehealth platforms require high-speed internet and extensive hardware. However, the untold story is that 42 million Americans can't afford broadband, and over a quarter of rural populations also lack access to broadband. Over 47% of people over 65 don't even own a smartphone. This is Paula, and she represents our demographic. She comprises the highest percentage of chronic care costs in the American health system today. Before COVID, she was getting 3 home care visits a week. And the current telehealth solutions simply are not appropriate for her because she doesn't have access or can't facilitate or navigate the technology. Our solution utilizes the flip phone that she actually owns to feed clinical data back to her home care agency so that they can triage and provide better care to her in the absence of telehealth.
So our solution really focuses on the use of unstructured supplementary service data, or USSD apps. This is actually older technology back from the 90s, which is why it actually works on older flip phones. They're also known as feature phones or candy bar phones, as they're colloquially known. This technology also works on smartphones. It's actually built into all of our handsets in one way, shape, or form. And if you've ever used a banking system, for instance, when you call up and you say, and the system says, press 1 for this option, press 2 for another option. That is an example of the audio sort of equivalent of this. This is not audio enabled. What this actually is again, an old school app that has been repurposed for a healthcare application. This is currently being used in other low resource contexts, such as Africa. And again, we want to bring this to the United States and use this for our populations that are similarly either have low literacy, low digital literacy, or resource or constrained. We are actually a beneficial solution to traditional, or I want to say traditional, modern telehealth platforms because we're internet independent. This relies on a mobile network and does not require you to have internet access. So and accordingly or associatedly, there are lower barriers to use for those individuals. It's cross-platform, as I outlined. It works on all models of phones, as long as they are GSM enabled. That means they have a SIM card. And it's low cost, no apps to buy, no content to download, no special equipment. You bring your own device. Also importantly, it is, again, a solution, a telehealth solution for those who cannot currently engage in modern telehealth platforms. In 2016, there were nearly 50 million adults over 65. By 2030, all baby boomers will have moved on and are past 65. At that point, 1 in 5 adults will be older than 65 out of the entire population. Our market, specifically rural individuals who are older than 65. Is that it?
You're at time.